Welcome to part 6 of musculoskeletal. This PowerPoint will focus on ergonomics, safe patient handling, and mobility. Ergonomics is the practice of designing equipment and work tasks to conform to the capability of the worker to prevent workplace injuries. Safe patient handling takes that theory of ergonomics and applies it to patient care. Patient handling injuries counts for more than 20% of all injuries to nurses, and they are the most costly occupational health issue in America. Nurses can make changes to how they care for patients to help prevent injuries. These changes can be related to how we move and turn our patients, and even how we change the linen on our beds. The most common reason why nurses get injuries is from uncoordinated lifts, awkward positions with movement, manual lifting and transferring patients, repetitive movements or tasks, and standing for long periods of time. The best way to prevent injuries as nurses is to have good body mechanics. Body mechanics is the use of efficient, coordinated, and safe use of the body. There are so many things we can do to prevent injuries, and usually the reasons why nurses don't do these things is from lack of time, lack of staff, and lack of equipment. The sad thing is, it's so much more time consuming and costly to not do these methods and get injured. Some tips for preventing injuries: position yourself close to the object or person to be lifted. Use a wide base of support, meaning widen your legs. Lower your center of gravity by flexing your hips and knees, and squat instead of bend. Face the direction of movement to avoid twisting your body. Don't lift more than 35 pounds, and don't move patients by yourself. Don't let clients pull you on the neck. Use your arms and legs and not your back. Leverage rolling, turning, and pivoting is a lot less physical work than lifting. Reduce friction by using draw sheets, slide boards, and roller boards to move the patient with less force. Use mechanical lifts or lift teams if the client is unable to assist. Coordinate lifting the patient with your coworkers by counting 1, 2, 3, then moving. And use a gait belt. Preventing injuries to our body is very important to keeping us healthy and able to work, but we also need to think about our patients. So many things affect their ability to be mobile, both at home and in healthcare facilities. First is developmental concerns. Babies and toddlers are still learning how to be mobile and are prone to mobility-related injuries. Kids and young adults are more prone to sports-related mobility injuries. And as adults get older, osteoporosis, balance issues, redistribution of adipose tissue, and loss of muscle mass all affect gait and stability, causing mobility issues. The older adults walk slower, are less coordinated, and are more prone to falls. As adults age, they have more physical health problems that can affect mobility and balance, along with taking some medications that can cause dizziness and balance issues. Adults with an active lifestyle tend to get less injuries unless their lifestyle includes high-risk activities like contact sports. People's attitudes and values in relation to activity, healthy diet, and exercise also affect mobility, because those who tend to live healthier lifestyles have less mobility issues. And fatigue and stress can have a negative impact on mobility. When the mind and body is overtired or overstressed, shortcuts may be taken with activities, which sets the person up for injuries. Also, when the body is physically stressed, muscles and tendons and ligaments can only handle a certain amount of stress before they overstretch and tear. Exercise and keeping the body mobile have so many huge benefits affecting every body system. Neurologically, exercise decreases stress, increases efficiency of nerve impulse transmissions, and improves blood flow to the brain. Cardiovascular-wise, exercise increases the efficiency of the heart's contractions, decreases heart rate and blood pressure, improves blood flow to every part of the body, and improves venous return. Respiratory-wise, the alveoli are better able to ventilate, the work of breathing decreases, and the diaphragm contracts stronger. Musculoskeletal-wise, exercise improves coordination, reduces bone loss, increases production of body heat, and controls weight, but increasing muscle mass and decreasing adipose tissue. GI-wise, exercise increases gastric mobility, increases triglyceride breakdown, and increases appetite. For as many benefits to exercise there are, immobility is equally as bad. Cardiovascular effects of immobility include orthostatic hypotension, venous stasis, thrombosis or blood clots or VTEs, and increased workload of the heart. While we don't discuss blood clots in Block 1, there's still an important risk factor for immobility that you need to know about. Blood clots cause significant issues in the body, including death if the clot goes to the brain or to the lungs. Respiratory-wise, the immobile person will have more secretions, higher risk of pneumonia, risk of blood clots in the lungs, and poor ventilation. Musculoskeletal system-wise, immobility, specifically bed rest, can decrease muscle strength significantly for each 24 hours of bed rest. Immobility can cause decreased joint mobility, bone demineralization, contractures of joints, and the increased bone breakdown can cause serum calcium levels to elevate to levels that can cause cardiac and kidney issues. Metabolic processes slow down with immobility, so the demand for oxygen and calories decrease. However, if the immobile person has an infection or fever or poor nutrition, the metabolic demands of those issues, along with the slowing from immobility, can cause significant muscle wasting. The gastrointestinal system is affected by immobility because appetite decreases, peristalsis decreases, and the person is at risk for constipation. The urinary system is affected by immobility because the immobile person has urine that sits in the bladder longer than normal, which allows bacteria to grow, causing a UTI. Skin is affected by immobility by the massive risk of pressure injuries. Immobility makes a person physically dependent on others, and this can cause depression, decreased social interaction, and affects your self-concept. Immobility can cause alterations to the sleep-wake cycle, which can cause people to lose track of their days and nights and cause confusion. One thing we can do to decrease some of these effects is to do range of motion exercises. We can do active range of motion, where the patient is helping move their own body parts, or we can do passive range of motion, where we do all of the movement on the body parts for them. There are a lot of things we can use to position our patients when they're immobile or in bed. Some of these things keep a person in a specific position, and some relieve pressure on pressure sites. Pillows are the easiest things we can use, as we can roll a patient and use pillows to keep them on their side. We can elevate their arms and legs on pillows, and they're squishy enough so they can relieve pressure. There are several types of mattresses we can use, from regular mattresses all the way to specialized air-filled constant motion mattresses that have zero pressure sites. There are beds that adjust up and down, some will rotate the person side to side, and some will even rotate them all the way onto their stomach. We have trochanter rolls, which is the picture on the left, that keeps the legs in place so they don't fall open. And then we have abduction pillows, which is the right picture, that keeps the legs spread apart. There are several positions we can put our patient in while they're in bed. When a person is laying on the back, we call this supine. When they're laying on their stomach, we call this prone. When a patient is sitting up in bed, we call this Fowlers, and Fowlers can have various variations depending on how high we put them. The bed elevated to 30 degrees is usually called semi-Fowlers, and 45 degrees or higher would be called Fowlers or high Fowlers position. We can lay our patients on their sides, either right or left. This position also has many variations depending on how far over they're turned. If a person is totally on their side, that is a 90-degree lateral, but this position causes a lot of pressure sites. The most common lateral degree is 30 degrees, as it doesn't have as many pressure sites, but it gets that weight off of one side of the body. When we move our patient, we want to change positions every 2 hours to prevent pressure injuries. We try to follow a pattern, right, supine, left, supine, etc. However, some patients can't lay on certain sides and some can't lay flat on their back, so we have to take that into account. When we move our patients either in bed or from bed to the chair or stretcher, we need to make sure that we're using good body mechanics so we don't hurt ourselves. We also need to make sure that we use enough people and equipment to not injure the patient or to not cause any shear or friction injuries to their skin. These pictures show ways we can move our patients safely. We have full lifts that move the patient anywhere we need to. We can use gait belts to help lift a patient who has strength but may have balance issues. We use draw sheets or lift sheets to move the patient without shear or friction. And we have sit-to-stand devices that help weak patients stand up. When we need to help our patient ambulate, we have some mechanical aids we can use. The first is a walker. Walkers provide stability when ambulation and are good for balance issues or when a person cannot fully bear weight on a leg. There are simple walkers, and then there are fancy walkers that have seats and storage. Next, we have canes. These are good for patients who may have some slight balance issues or they're not fully weight bearing on a leg and need a little bit of support. Canes can have 1 support leg all the way up to 4 support legs. We have braces and crutches that are good for people with good strength and balance, but may have 0 to little weight bearing ability on a leg. And then we have scooters. Scooters are good for people like Scooter Boy, who couldn't put any weight on his leg at all, but he had to carry a heavy backpack around school, so crutches were not an option for him. And this is the end of part 6 of ergonomics, and this is also the end of musculoskeletal.